Hvert år rammes mere end 30.000 danskere af kræft. Af dem dør cirka halvdelen, og kræft er dermed stadig den sygdom, der koster flest danskere livet. På laboratorium på Syddansk Universitet arbejder en forsker, som har viet sit liv til at udvikle nye effektive stoffer til at slå cancerceller ihjel. Hun arbejder især med kræft i bugspytkirtlen, som er en af de mest dødbringende cancertyper.
It's about understanding what makes a specific type of cancer cells so resistant towards chemotherapeutic treatment and finding ways to fight cancer back.
Kræft er en sygdom, der kommer af mutationer i bestemte gener. De sidder i den del af den menneskelige DNA, der indeholder informationer om proteinerne i vores krop, og som er vigtige for vores normale celler, så de kan vokse og overleve.
Modifications in the synthesis rate and or function can have serious consequences because this can lead to uncontrolled cell proliferation and growth of a tumor cell population. At the molecular level, all cancers have things in common. However, they show common but not identical patterns of alterations. And this is the reason why some type of cancers have high resistance towards treatment than other type of cancers. And a clear example is human pancreatic cancer that is, we know, very resistant toward treatment. Here in the first slide, I show you the difference between normal cells and cancer cells. We look just at the morphology, and we can see clearly that normal cells grow, but they don't grow on top of each other, but they connect. When they become cancerogenic, we can clearly see a difference in their morphology. They can grow on top of each other. We say they overgrow, or they just adopt a more round shape. This is because they also gain a higher mobility. In this slide, we look at a tissue section of human pancreatic cancer, and we look at the organization of the cells. This is the normal part. These cells are healthy, they are well organized. But when we look at the cancer part, here we can see that the organization of the cells is much more chaotic.
Det hele begyndte tilbage i 1996. Her arbejdede Guerra som Ph.D.-studerende på Syddansk Universitet. Her karakteriserede hun en specifik klasse af enzymer, som kaldes proteinkinaser.
At that time I was studying the conformation, that is the shape of protein kinases and their function in cells. And I got more and more fascinated by the work I was conducting with human cancer cells because I thought that this type of experiments would lead to exciting results and new developments within the field of cancer cell biology. Protein kinases are a huge family of enzymes that have the power to influence many physiological processes. They are fast-acting enzymes and they also connect and communicate with lots of different proteins. This is a simplified schema, but you can see already that actually really they act by communicating or interacting with other proteins. We focus on those protein kinases that support survival and cell proliferation, and we try to understand the way they influence tumor progression but also initiation. And we try, of course, to block their action. It is a bit like when you have a broken car. First you try to understand where the problem is, and then eventually you replace or repair the broken piece.
Guerra og hendes forskningsgruppe tilbringer en stor del af deres arbejdstid i laboratorierne. Her tester de effekten af stoffer, som nedsætter proteinkinasernes aktiviteter, og som derved har en markant indflydelse på cellernes evne til at overleve.
First, we screen libraries of compounds and we look at their ability to block the activity of selected pro-survival protein kinases. The next step is to take these compounds and incubate cancer cells and look whether they induce cell death. But we also look at the mechanisms that are induced by cell incubation with these small molecules.
Forskningsgruppen arbejder både med humane cancerceller dyrket i cellekultur og indsprøjtet i forsøgsdyr.
Primary aim is the selection of one of the many compounds that we test and perform in vivo experiments. We do that by treating mice with these compounds that we have selected. And currently we are actually testing one of these small molecules in nude mice heterotransplanted with human cancer cells.
Målet for Barbara Guerra og hendes forskningsgruppe er at forstå, hvad der gør specifikke cancerceller modstandsdygtige over for kemoterapi, og dermed udvikle en mere effektiv cancerbehandling. Forskningen er dog uhyre tidskrævende, og der vil endnu gå mange år, før man kan forvente egentlige resultater.
The ultimate goal is to obtain convincing results for setting up clinical trials and try to find an improvement in the cure of human pancreatic cancer. I'm confident that this will be achieved in the next 8 to 10 years.
I will give you my sample.
Yes.
And you look if it's okay.
Cancer is a highly heterogeneous disease. We know that patients affected by the same type of cancer, undergoing the same type of treatment, often respond differently. That is why it's so difficult to cure this disease. And that's why I also believe that it is important to attack cancer on every possible front, from prevention to cure. Every achievement and positive result is important, as I consider that patients deserve the best possible treatment and care.